Hello, I'm Jim Bates, former football coach. I coached for 40 years at every level, last 17 years being in the NFL. I have a story to say about what I had taken place over the past couple of years, and a little introduction into how I came to the decision of going with Dr. Wheeler. In the NFL, we had tremendous physicals every single season. Before the season started, and my PSA was taken, I was in the high ones, and then eventually I was in the low twos, 2-1, 2-2 being the highest. After I was through coaching, I retired 5 years ago. I kept getting my PSA, and it did rise to 4 point. Went from 2-2 to 4 point. My experience with the prostate cancer goes with many friends. My roommate in college had it. My brother had it, and several friends and family members, a total of 8 or 9. And they had it as far as some had it removed totally with surgery. Some had the seeds. Some had the radiology, and some had even a chemo treatment or two. And I'd known a lot about it from that sense of it, as far as with my friends and everybody. When I had the 4 point, I went, my medical doctor sent me to a urologist. I went to the urologist, and he said, Jim, he says, I need to take a biopsy. And I didn't know anything about anything. As far as I'm a football coach, I don't pertain to be a doctor or a student of medicine, and so I think this is fine. I'm going to go have the biopsy taken. Well, the biopsy comes back. I'm called back to the urologist's office, and he says, Jim, you have, and he showed me the diagram and everything, you have less than 5% up in this upper right hand corner of your prostate. And he says, I think you need to go to there's a new lab in a practice being done over in Clearwater, has the new radiation treatment center, and you need to go there. And I said, hold it, doc. I said, I only got less than 5%. I have several of my friends, and as I mentioned before, that have had this, and I want to delay this right now. And he says, okay. And so he gave me some medicine. Next time I came back, it was at 2.6, and he says, well, this was 3 months later. He says, let's just stay on the medicine and see how it does, and we'll keep it under watch for the next several months. So in the meantime, I'm thinking, hey, the medicine's helping. I'm fine with my prostate. I go to see a professional friend in Sarasota. I'm having treatment done in his office, and he calls me in after the treatment and says, Jim, I need to talk to you. And he says, I don't want anybody to know, but I have prostate cancer. And I interrupted him. I said, Joe, I said, nobody knows that I have it too, not even my brother. The only one that knows about it is my wife, and I have less than 5%. Well, he tells me about his situation, PSA, how high it is, and he says, you need to go see Dr. Wheeler. And after a long talk, we made that decision to go. We went and saw Dr. Wheeler, and he gives me an examination. He says, Jim, I think you have more than 5% as far as cancer cells in your prostate. And I said, well, what do you recommend? He says, you need to go get your MRI done. And it's right here in town. So I signed up, got the MRI. It came back again. I came back and visited with Dr. Wheeler, and me not being a doctor, I mean, you could see the cancer cells throughout as far as the one side of my prostate. And the one area that was very, very clear, there was a bulge going towards my bladder. And I said, doctor, what do you think? And he says, I think we need to do a procedure, HIFU procedure on you. And I agreed to that. And then within 2 weeks, I was having my prostate treated. Incredible experience. My wife and I flew to Cancun. It has not been approved by FDA. Stayed at the Hyatt, had a tremendous experience there. Met with other patients the night before. Doc went over as far as the procedure that he was going to do, gave us confidence that everything was going to be fine. I went, had the procedure done. After I came back, after the procedure, my wife was there. We rode back to the Hyatt with Dr. Wheeler, and that night I ate dinner with my wife. The next morning, got up, moved around, did a lot of things, and that night we went out and ate with another patient out on the beach, and it was incredible. It was like, other than having the catheter, I wouldn't even known I had an operation during this procedure. Flew back, had the catheter in 10 to 12 days. Did have a little leakage, which was not a major problem. In 6 weeks to 8 weeks, and I stay in shape. I was back conditioning, and I never missed a beat. Sexual activity, nothing. I mean, it was a procedure that just, I was so fortunate to run into my friend, run into Dr. Wheeler, and everything fell in line for me to make this decision and go forward with it. I'm a year and 2 months out from the surgery, and if I had it to do over again or recommend to any of my friends, definitely would have this done. My roommate in college, one of my best fishing friends, they had the surgery. They went through 6 months of total hell, and the seeds and everything, as far as the results, as far as on that and on the radiology, you know, you can make the decision, you know, the way you feel fit. But I feel like HIFU, with what they have done, the success that Dr. Wheeler has had with the HIFU, he's one of the best in the world, if not the best in the world. I'd recommend that you take this into consideration, you look at it, and I would recommend highly that you seek out Dr. Wheeler. Thank you.